Hello, everyone, and welcome to Vet NeuroJar, the podcast where we delve into the fascinating world of veterinary neurology and anesthesia. I'm your host, and today we're going to be discussing a particularly interesting case study highlighted in a recent letter to the editor. It involves a rather complex situation of a dog with multiple health issues undergoing anesthesia for a dental procedure. This case is a great example of how veterinary medicine is constantly adapting and learning, especially when dealing with rare and challenging situations. Our story centers on an 8-year-old, neutered male Chihuahua mix weighing just over 4 kilograms, or about 9.5 pounds. This little guy had a history of hyperadrenocorticism, also known as Cushing's disease, a condition where the adrenal glands overproduce certain hormones. What made this case extra challenging was that the dog also developed myotonia associated with his hyperadrenocorticism. Myotonia is a condition characterized by muscle stiffness and rigidity, and in this case, the dog exhibited a stiff gait and noticeable rigidity in all 4 limbs. The dog had been under the care of internal medicine and neurology specialists who diagnosed his myotonia based on his history of hyperadrenocorticism and the neurological examination findings. An electromyography test might have been performed to differentiate hyperadrenocorticism-associated myotonia from congenital myotonia, but this test was not available at the clinic. Before we delve deeper, it's important to note that the dog's hyperadrenocorticism was well controlled with medication, specifically oral trilostane, administered twice daily. However, the myotonia, unfortunately, remained unchanged. So, why did this little fellow need anesthesia? Well, he had a history of excessive drooling, also known as sialorrhea, and a rather unpleasant brown fluid coming from his oral cavity. A thorough oral examination revealed significant dental issues, including calculus, gingivitis, some loose teeth, missing teeth, and a fractured tooth. Therefore, general anesthesia was required for dental extractions. The goal for the veterinary team was to handle the dog's dental issues while also managing the complexities related to the patient's myotonia, which made anesthesia more risky. Before the surgery, the team ran a comprehensive blood count and biochemistry analysis, which came back unremarkable. They also did a venous blood gas analysis that showed the dog's electrolytes, blood urea nitrogen, creatinine levels, and hematocrit were all within the normal reference range. In preparation for anesthesia, the dog was given premedication consisting of intravenous fentanyl, midazolam, and meropitant. This was administered through a catheter in the cephalic vein in his front leg. After a brief period, anesthesia was induced with intravenous propofol. However, the dog required additional medications to reach a suitable level of anesthesia, including a low dose of ketamine and more fentanyl, to facilitate intubation, the process of placing a tube down the dog's trachea to maintain an open airway. At this stage, the anesthesia technician noticed some resistance when trying to open the dog's mouth. Once the dog was intubated, they initiated a partial intravenous anesthesia technique, combining isoflurane carried in oxygen with a propofol constant rate infusion, which is a steady stream of the anesthetic medication. This approach is often called a partial intravenous anesthesia technique. Before the dental work began, the team added a fentanyl constant rate infusion and discontinued isoflurane, maintaining anesthesia with the propofol constant rate infusion. This protocol was partly inspired by human literature recommendations for anesthetizing patients with congenital myotonia, specifically suggesting total intravenous anesthesia due to the higher risk of malignant hyperthermia, a dangerous and life-threatening response to certain anesthetic agents. The team wanted to be proactive as they did not want to risk that occurring in their patient. Anesthetic monitoring was thorough, including an electrocardiogram, a rectal temperature probe, an oscillometric arterial blood pressure monitor, pulse oximetry, and end-tidal carbon dioxide tension. These monitors ensured the dog was stable and safe under the effects of the medications being administered. After some initial dental X-rays, the dentist began to have difficulty opening the dog's mouth further, due to excessive muscle rigidity. Despite the muscle rigidity, the team noted the dog was at an appropriate anesthetic depth. To address this, they administered a bolus of intravenous dexmedetomidine, a drug known for its muscle relaxant properties. This was followed by a continuous rate infusion of dexmedetomidine to maintain muscle relaxation throughout the procedure. The team used local anesthetics called regional blocks that were performed with bupivacaine, administering maxillary blocks bilaterally and middle mental blocks bilaterally to provide additional pain relief during surgery. Now, the dental procedure was extensive, involving the extraction of 25 teeth. The case team closely monitored the dog's electrolyte levels, especially potassium, because high potassium, or hyperkalemia, has been seen in human patients with myotonia. Throughout the procedure, the team ran serial venous blood gas analysis approximately hourly. Fortunately, the electrolytes remained stable. However, they noted a progressive decline in the hematocrit, which they believed to be a combination of blood loss during surgery and dilution due to intravenous fluids. Most other physiological variables remained stable except for one episode of bradycardia and hypotension, which responded well to intravenous glycopyrrolate and reduction of the propofol infusion rate. Bradycardia is a slow heart rate, while hypotension is low blood pressure. These conditions can be detrimental to any patient during a surgery, so the team had to respond rapidly. The dog recovered well after 3 hours of anesthesia, and he was discharged with oral carprofen and gabapentin for analgesia. This combined analgesic approach helps to manage pain and discomfort. There are no other documented reports of anesthesia of dogs with hyperadrenocorticism-associated myotonia. It is known that abnormal electromyography in conjunction with a poor response to various muscle relaxants can be difficult to treat. In this case, dexmedetomidine was effective in achieving muscle relaxation for this patient. Other reported anesthetic complications associated with muscle disorders in humans include respiratory depression, aspiration, and cardiac arrhythmias. The team did not encounter any of these issues in their patient. It's fascinating to consider the effectiveness of dexmedetomidine in this case. It is known to be a muscle relaxant in dogs and has also been found effective for muscle contracture disorders in humans. Another option for muscle relaxation in veterinary medicine is procainamide, but dexmedetomidine has advantages, including its reversibility, analgesic properties, rapid onset, and minimal respiratory depression. Myotonia as a consequence of hyperadrenocorticism is a rare phenomenon. The underlying mechanism of the myotonia is not fully understood, although various theories have been proposed, including decreased intracellular potassium, abnormal calcium metabolism, increased protein catabolism from high levels of glucocorticoids, and changes in myofibrillar protein synthesis. Because the mechanism of myotonia is unclear, serial electrolyte monitoring was essential in the patient's case. The authors concluded that dogs with hyperadrenocorticism and secondary myotonia can be anesthetized successfully. However, it's important to tailor anesthetic protocols to maximize muscle relaxation, and meticulous electrolyte monitoring is essential. What this case study shows is that while the mechanism behind myotonia and hyperadrenocorticism is still unknown, the importance of careful and adaptive anesthetic protocols is key to positive surgical outcomes. The use of dexmedetomidine and constant monitoring, based on human literature, proved to be a successful combination for this complex case. This case also highlights the importance of literature searches and that lessons learned in human medicine can inform veterinary practices. The case underscores the value of collaborative work between internal medicine, neurology, dentistry, and anesthesiology veterinary specialists. This highlights the value of veterinary teams coming together to help patients, as well as how veterinary medicine is a field of constant learning, and that when faced with new challenges it is paramount to learn from each case. It also highlights that while some conditions are not commonly seen, they are still something that the veterinary professionals should be aware of. There is always something new to learn, which is why I love this field. Thank you for joining me on Vet NeuroJar today. This is a great example of how veterinary medicine is always learning and adapting. It's also an example of how the veterinary medical team can come together to tackle a unique situation. I hope you found today's episode as informative and interesting as I did. Remember to consult with your vet or a specialist if your pet is experiencing these symptoms. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.